Can fibroids be treated medically, that is without surgical intervention? Watch this video to the end and I will show you how this can happen and crucially how they actually work to solve the problem. Welcome back. I'm Dr. Sylvia of Askawayhealth, where we provide you with clarity and direction about everything medical. Please subscribe to my channel, and when you do, don't forget to click that notification bell so that every time that we publish new videos, you'll be the first to know about them. So let's get into this. We've been talking about fibroids for some time. Remember that fibroids are benign growths within the womb of the woman. Now, they're quite common, affecting between 30% to 40% of women. There are also different methods for treating fibroids. They will depend on several factors, some of which might be how large is the fibroid, where is it located, the symptoms the fibroid is causing, the person's age, and possibly what they want to do in sense of, are they about to have a family or start a family, trying to get pregnant, or have they already finished their family and they do not wish to get pregnant. So these are the factors that one will need to take into consideration when looking at what is the best treatment that you want to recommend for any person. Now, people can consider different methods to try to remove the fibroids, address the symptoms they are causing, and these methods could include natural treatments, or they could include surgical treatments, in which case the fibroids are removed, or the uterus, the womb itself, is taken away. The treatments that we're going to consider in particular in this video are what we call the medical treatments of fibroids. This means that you do not have surgical intervention and you're using some form of medicine or the other in which to either control the symptoms associated with the fibroids or to try and reduce the size of the fibroids. I'm going to look at these medicines by talking about the different types of symptoms that they could control and other measures that they could be used to treat fibroids. The first one is looking at how they control pain from fibroids, and the second one is how they can control bleeding, and lastly, how can they control the size of the fibroids. So let's get started. So in the first group, our treatment goal is to control pain. This can be pain that's associated with the period, so having very painful periods, or it could be pain that's related to in the lower abdomen, located in the lower abdomen or the pelvis, or pain that's located in the lower back of the woman or along the legs. Now, we have discussed at length the symptoms of fibroids, so if you haven't seen that video yet, please go and check it out, because we talk in detail about the different symptoms that could present in somebody who has fibroids. So talking about medicines that we use to control pain depends on the severity of the pain that the woman is experiencing. Some ladies might just require simple pain medications, for example paracetamol, or non-steroidal anti-inflammatory medications like ibuprofen, naproxen and aspirin. Some might require a lot more stronger medications, such as those that contain opiates. So that depends on the degree or the severity of pain that the woman is experiencing. The next group of medicines are those that are used to control the heavy bleeding associated with fibroids. Now, these can be classed into two categories: one group that contains hormones and another group that does not have any hormones. Now, talking about the ones that do not have hormones, among these is a drug with a similar composition to aspirin, which is called tranexamic acid. Tranexamic acid works by stopping the small blood vessels in the womb lining from bleeding. Now, this can lead to reduction in blood loss of about 50%, so you can see why it's quite beneficial for somebody who has very heavy bleeding from the fibroids. In addition, tranexamic acid can also kill off some of the fibroid cells, which can contribute towards shrinking the fibroid and also help in managing the symptoms. The second group of drugs that are used to control the bleeding in fibroids contain hormones. Now, this can be a little bit complicated, because remember that when we talked about the risk factors or the factors that contribute towards the development of fibroids, we talked about the possible effect of hormones. So it's a little bit complicated, but it's been found that the use of hormones, for example those in the family planning or contraceptive pills, can reduce the amount of bleeding from fibroids and control the menstrual period. In the same way, the use of the intrauterine system, which is the contraceptive coil that has progesterone contained within it, can also help to lighten bleeding when it is placed within the womb of some women who have fibroids. The way this happens is that the contraceptive coil containing fibroids, which is known as the intrauterine system, releases small amounts of progesterone gradually over time within the womb, and that can also help to reduce the womb lining and therefore reduce the amount of bleeding. Apart from the intrauterine system, other forms of progesterone can also be used to manage the same problem of heavy bleeding. So for example, you might have oral progestogens, which can be used and taken on a daily basis for a period of time during the menstrual cycle to control the amount of bleeding. They're not used as contraception, so it's important to make sure you have a discussion with your doctor so that it's clear what the aim for taking the medication is. The injection progesterone, which is known as the Depo-Provera, can also be used in some women to control bleeding. Now, this is also used as a form of contraception, but I would like us to remember that these medicines contain or have side effects. For some women, taking this contraceptive medication might result in more irregular bleeding. It is always on an individual basis that you decide which medication is suitable for which particular woman, and the advice must always contain what possible side effects to expect when taking the medication and how to come to an alternative approach if things do not work out as expected. So now that we've looked at a couple of methods, I would like you to comment down below and share with me what's been your experience using these medical treatments. Has the problem been that they've not really been effective for treating your condition, or has the problem been more that the side effects were so intolerable you couldn't get on with them, as some women do experience? So we're coming to the third class of medicines that I want to talk about today, and these medicines mainly aim towards shrinking fibroids, and so they could also help in dealing with the pain and the bleeding associated with the fibroids. Generally, they are also hormone-containing medication, but they work differently to the way that family planning or contraceptive medicines would work. So the first one to look at, the GnRH analogs. These are hormones that are similar to a hormone that's actually produced in the body. By taking them, a false state of menopause is temporarily created in the body. And what happens is that when these drugs are consumed, they help to shrink the fibroids until you stop taking them. So they can be useful for helping with fibroids that cause very heavy bleeding, that cause anemia, and in particular for women who are about to undergo surgery with very large fibroids. These drugs could be useful in reducing the size of the fibroids and making surgery easier, reducing the risk of heavy bleeding in surgery as well. The thing about these GnRH analogs is that they have significant side effects. One of them, for example, is bone thinning, a condition called osteoporosis, and that's why it's important that a woman shouldn't stay on them for a prolonged period of time because of the potential effect they can have on the bones. So the side effects of the medicine should be discussed with your doctor. But apart from dealing with the bleeding, the size of the fibroids, because they help to shrink them, they can contribute towards reducing the pressure, the discomfort for the pressure of the fibroids sitting in the woman's abdomen, and this can help to deal with symptoms like constipation or problems with urine, which we discussed when we're having our video session on the symptoms of fibroids. GnRH analogs are also given as injections, so it means that the woman has to attend a clinic appointment for the period of time while she's on the course of GnRH analogs, but they can be effective. The important thing is just to look at the side effects and make sure they're not being taken for a prolonged period of time. Now, the second drug within this class, which is hormone-like and affects the size of the fibroids, are the selective estrogen receptor modulators. This class of drugs work by affecting estrogen receptors in different ways around the body. Now, they can also induce a menopause-like state, and so they may be effective in shrinking fibroids. However, there are still studies going on the degree of this effectiveness vis-a-vis their side effects. Some studies suggest that they have less side effects compared to the GnRH analogs, but are they as effective? Still a few questions going on in that direction. They are probably reserved for women who may not have had much benefit with using other medication, and of course they're usually commenced or initiated by a specialist if needed for managing fibroids. The last group of drugs that we're going to look at that falls within this class of medicines that shrink fibroids is another hormone-like medication known as the selective progesterone receptor modulators. An example of this is ulipristal acetate. Ulipristal works by blocking progesterone in the womb. As you recall, progesterone we think has a role in promoting the growth of fibroids. So what this medicine does is that it helps to shrink fibroids by limiting the effect of progesterone. In addition to shrinking the fibroids, it also helps with heavy bleeding. And another benefit of this particular medicine is that it's taken in tablet form. So for some women, it might have the advantage that you don't have to go to the hospital every month to have an injection, as would happen, for example, with using the GnRH analogues. Like the other hormone medications, these will come with side effects as well. What I've done is I've included in the link in the description below the common side effects for each of these group of medications, so that will be useful for you to look at when considering them as options for your treatment. So there we are. Those are the solutions, the medical solutions that we have at present for managing fibroids, mainly classed into those that can help stop the pain, help stop the bleeding, and help to shrink the fibroids. And as you've seen, some of them do more than just one of each of these measures. I hope watching this video has been helpful. If this is something that you would like to gain some more information about, please send me an email on info@askawayhealth.org. I've included a link in the description below for our heavy menstrual period checker, which I always insist on making available for women. Some women don't realize that they have very heavy periods or very heavy bleeding, or that their bleeding pattern is abnormal, and so they don't come to seek help early or to seek advice early, and in such ways you might not realize that you have fibroids until things have become quite advanced. I have also left a link in the description below to our infogram on foods and how they affect fibroids, which I think is a useful at-a-glance tool that helps you decide which foods that you should avoid and which you should use or take if you have fibroids. Because remember that fibroids are associated with high estrogen levels, so eating foods that have high estrogen content can contribute to the growth of the fibroids. Also a link in the description to our video on how hormones work. If this is a topic that's of interest to you, please watch that, because we talk a little bit about some types of hormones and how they work around the body to control different effects. So we've come to the end of the video. Thank you for watching. Don't forget to subscribe to my channel and click that like button. If you found it useful, share it with a friend. Oh, and leave a comment for me. Tell me what you thought about the video, or what your experience with medical treatments of fibroids have been, or ask any question if you wanted to clarify anything. I hope you share the video with a friend, but also keep an eye out on our channel, because we have so many more topics coming up about fibroids and loads more other medical conditions. Until the next time, have a great day.